Okay, so this is our last lecture on the lower limb. So we'll finish up talking about the foot, and then we'll move on to the initial parts of the upper limb tomorrow, so we get a little bit of that before we have Dr. Carlson come in and talk to us about. He'll be doing at least, and has to do some upper limb, some lower limb, so we'll try to hit the high points of the upper limb tomorrow to make sure you guys are prepared for whatever he pulls out of the bag. Okay, so continue on with structures of the foot and ankle. Whoops. So the tarsal tunnel, remember this is another one of those places where neurovascular structures are close to the surface. It passes underneath the the medial malleolus here, and then tucks in down around the bottom of the foot, and is bordered by the tibia, that medial malleolus, the talus bone, and then this flexor retinaculum. So the structures moving through it are the tendons of the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. So the major tendons. We have the tibial nerve, and then we have the posterior tibial artery and its associated veins. And these associated veins, I want to talk about them for a moment, because in the extremities, typically an artery is accompanied by one or more veins that run right next to it. And there's a couple of reasons for this. One of them is that the pulsation of the blood through the arteries helps move the blood through the veins as well. So we get the expansion of the artery with every pulse of blood, helping push the blood back up through the veins. And then also, this is involved in countercurrent heat exchange. And countercurrent heat exchange is basically a way of preventing too much heat being lost in the extremities. So as the warm, and also from cold blood coming back into the core. So we've got warm blood moving down the arteries out towards the end of the extremities, and as it passes through those arteries and the veins are right next by, the veins are coming back with blood that's been cooled because we had heat loss at the extremities. And so then heat is transferred between the warm arteries and the cool veins, and kind of just moderates the temperature difference between them. So we have a little bit less heat going towards the extremities, and the blood that's coming back into the core has been warmed slightly, keep it, the core warmer. So those are the reasons we have these associated veins here beside the arteries, and you'll see this both in the lower limb and the upper limb. Excuse me. Another thing to mention about these areas where the vasculature is close to the surfaces, these are places where we can take a pulse. So we can take a pulse of the posterior tibial artery by palpating midway between the medial malleolus and the heel, right in this region. So this can give us some ideas of blood flow to the extremities. Okay, so that is the tarsal tunnel. Just a quick surface view. So this would be the location of the tarsal tunnel, kind of looking from the surface. So the medial malleolus would be right here, that bump there. Okay. Questions? Pretty simple? Yeah.
Does it always run in the same pattern, like?
So it'll be
Tendon, artery, nerve?
not necessarily. No. Yeah, there's no real pattern to that, unfortunately. No. Okay, so then remember we talked about the arches of the foot at the beginning. So we have our transverse arch here, and some structures that help support that transverse arch are the fibularis longus tendon, and then the tibialis anterior and posterior tendons both help. This one helps with both the longitudinal and transverse arch, and then this one helps maintain that transverse arch. So part of that shock absorption occurs from the tendons of these muscles. We also have the longitudinal arches, so the larger one, remember, is the medial longitudinal arch. And we have structures that are supporting that. The plantar aponeurosis is one of the major ones. And for the tendons that we're talking about, they obviously they're attached to muscles, and so we can have dynamic control of the shock absorption and the elastic rebound from. We'll bounce back to that slide real quick. Where is it? From these tendons, so we can change the tension of these tendons. So tension is dynamic. So dynamic. There we go. So that we can control how much elastic rebound and how much shock absorption occurs, how much support that these give to the arches, based on the type of locomotion and the stresses on the foot. All right, so that is the arches. So we'll move to looking at the plantar aponeurosis here. And so that is a thickened area of deep fascia. Excuse me. That attaches to the calcaneal tuberosity and then to the plantar surfaces of the digits. And not only is this really important for that shock absorption, so this is kind of like the elastic band maintaining shock absorption, but this is also important for protecting the underlying regions of the foot. So it's really important for protection of all of those deeper muscles and nerves and vessels. When this becomes inflamed, that is plantar fasciitis. Good. Okay, important structures of the soles of the foot. So there's a lot of different structures on the sole of the foot. It's a very complex one. I'm just going to point out a few that I would like you to know. So obviously we have the tendons that are wrapping around through the tarsal tunnel and then spreading out across the sole of the foot. So we have the flexor digitorum longus spreading out to each of the toes, the flexor hallucis longus going to the great toe, and the tibialis posterior attaching in midfoot region. There are, I'm trying to remember what I had here. Right, okay. There are a couple other things I want to point out. So these structures right here are fibrous sheaths. And these are sheets of connective tissue that help bind the tendons to the surface of the bone, so it helps stabilize their position, and then also helps protect them. Inside of that, we have the synovial sheath, and that is, so if we have the tendon here, that's a double layer of synovial membrane that wraps around the tendon, kind of like this. It's got synovial fluid in the middle of it. And so it acts kind of like a bursa. It acts like a kind of bursa that's wrapped around the tendon. And this allows for the tendon to slide and glide between, within that sheath very smoothly, so it reduces the friction. Okay. So
the fibrous wraps around the synovial tendon sheath, which wraps around that.
Yeah, so we've got the synovial sheath right around the tendon, and then we've got the fibrous sheath that wraps around it and actually helps anchor it to the bone.
Okay.
So here we'll do this. Our synovial would be in red. There we go. There we go. Okay, so again, just protecting those tendons, allowing them to glide smoothly, because at least for these tendons, there's quite a lot of movement as the muscles contract. Okay. Right, so there's several muscles on the sole of the foot. I want you to know the superficial layer, okay? In the detail that we've been talking about, all of the layers of all of the muscles of the lower limb. The rest of them, I want you to at least be aware of the term, aware of the names, have them had passed through your brain at least once, so that if you need to learn them, that's not quite such a challenge. But I'm not going to ask you to learn the details of insertion and innervation. So the ones I do want you to know are the abductor hallucis. So this is going to abduct the great toe, so move it away from that second digit. The abductor digiti minimi, which is going to abduct the little toe. And then the flexor digitorum brevis. So it's again to flex toes 2 through 5. Okay. They all insert onto the, or they all originate on the calcaneus, this calcaneal tuberosity. And then the insertions are on, for the flexor digitorum brevis, the insertions are on the plantar side of the digits, and for the abductor muscles, they're on the sides of the digits. So lateral for the abductor digiti minimi, medial for the abductor hallucis. Okay, so these are the three muscles that I want you to know in detail. Excuse me. They are innervated by the plantar nerves. So this abductor digiti minimi is innervated by the lateral plantar nerve. And let's double check, make sure. Yes, okay. These two both are innervated by the medial plantar nerve. Okay. Right. So we're going to go through the rest of the layers of the foot just as a pass it through your brain one time. Be aware of it. Be aware of the names. But I'm not going to emphasize them in any way. So this is our most superficial layer of muscles, and we go down deeper, and we have two muscles here, the quadratus plantae and the lumbrical muscles. Again, just be aware that they exist. Then next layer down, we have the flexor digiti minimi brevis, the flexor hallucis brevis, and then the adductor hallucis. And thankfully for these, the names are pretty self-explanatory as far as their function goes. But again, just be aware that they exist. Right? All right, and then the final group are the interosseous muscles. So we have dorsal interosseous muscles and plantar interosseous muscles. And I do want you to know that the plantar interosseal muscles adduct the digits, and the dorsal interossei abduct the digits. Okay. Good. Any questions? Anything you need to fill in? Okay. All right, so then the dorsal surface of the foot is much simpler. There is not as much going on there by a long shot. So we're just going to take and go through several different layers, starting with the extensor retinacula. So we have two extensor retinacula you've been learning in lab, the superior and the inferior. And what is the function of these?
Hold everything tight.
Mm-hmm. Yeah, hold those tendons down to the bone. So what would happen if these were non-existent and you contracted those muscles? The tendons pull. Yeah, so the foot would fold up, kind of like stringing a bow. You know, they would lift up off the surface of the bone, and you would actually. So here's a foot. That's a nice foot. And so instead of tracking along the bone, they would lift up, and you'd actually see a rising of the skin off the. So these prevent that lifting of the tendons. Underneath those are, again, synovial sheaths, so there's a lot of friction between the retinacula and the tendons, because the tendons are sliding between two structures that are, you know, bound close together. So the synovial sheaths are important there. And then I want you to be aware that there's one major intrinsic muscle on the dorsal part of the foot, the extensor digitorum brevis. So you need to know the extensor digitorum brevis. And that one originates on the calcaneus. There's a superiolateral part of the calcaneus here. And then inserts on the dorsal portions of the digits. Like its name implies, it's an extensor of the digits. And it is innervated by the deep fibular nerve. All right, so those are the main muscles. You should be aware of where the ligaments of the muscles we've already talked about run on the foot. But those are the main muscle and ligamentous structures I want you to be aware of. But yes, there is one more. The extensor hood. So the extensor hood is a broad triangular shaped ligament that wraps over the top of the digits and has attachments with the lumbrical muscles and their interosseous muscles. Okay, so this the tension on this can be changed, so that the tension is dynamic. And they aren't entirely sure what all its purpose is, but at least we do know that when these muscles contract and tighten down the extensor hood, it helps spread the action of those muscles out over the digits, and it causes flexion of the metatarsal phalangeal joint, and this is a protection against overextension, and then also causes extension of the interphalangeal joints to prevent overflexion. And they think it's most commonly used, this mechanism most commonly used during walking, or during also during standing, to allow for flexion of the toes to help with balance and push off, but preventing damage from overflexing, overextending these. Okay. So that's the extensor hood. Okay, so blood vessels supplying the foot. So we start off with the posterior tibial artery coming in through the tarsal tunnel, and that splits into the lateral plantar artery and the medial plantar artery. The medial plantar artery basically supplies some of the medial structures of the foot and the great toe. The lateral plantar artery spreads out and supplies most of the rest of the sole of the foot through the deep plantar arch. So we have this arching structure. I'm going to change colors. Here, deep plantar arch, and then branching off of that are the plantar metatarsal arteries and the digital branches of those. So we just have these branches coming out towards the digits from that deep plantar arch. The deep plantar artery here dives between the metatarsal, first and second metatarsals, and actually anastomoses with the dorsal pedis artery, the terminal branch of the dorsal pedis artery. So here's this anastomosis. Okay. So if we flip the foot over, oh, nope, we got one more structure. So I just wanted to have a image that tracks the lateral plantar artery as in relation to the medial arch of the foot, so it kind of tracks around the edges of that medial arch. Okay, so here's the dorsal side of the foot, and right here we see the deep plantar artery coming up through the interosseous muscle between the first and second metatarsals, and that is that anastomose with the dorsal pedis artery. So here's the dorsalis pedis. The dorsalis pedis is a continuation of the anterior tibial artery, so we have kind of this blood flow going on here. We also have a branch off of the dorsalis pedis, the arcuate artery, that is kind of like the deep plantar arch, where it crosses the foot from medially to laterally and provides the blood flow for all of the branches supplying the metatarsals and digits. So we here have our dorsal digital arteries. Something that's important to note is that all of the arteries, and actually all the veins and nerves, all run on the sides of the digits, and there's no blood flow and no innervation on the dorsal or plantar sides of the digits. It's all along the medial and lateral sides and between the digits. It actually is very smart, because as many times as I drop things on my foot, I'd really have some serious damage to those nerves by now.
Just dorsalis pedis artery leads to, deep plantar artery is a branch of the dorsalis pedis artery.
So the dorsalis pedis artery dives deep from the dorsal part of the foot. The deep plantar artery, here, let's go back to here, moves up from the bottom of the foot, and it's actually an anastomosis between those two. Okay, so this right here is a continuation of that vessel that went into the interior of the plantar surface of the foot. Okay. Any other questions? Oh, yeah.
You said, can you just repeat the last part about there being no major, was it vessels or nerves?
Both.
Both, okay.
Yeah, so no vessels and no nerves, no major vessels or nerves on the superior or inferior portion of the dorsal or the plantar surfaces of the foot. They're all, or of the digits, they're all running along the lateral and medial sides of the digits.
Okay.
Yeah.
Thank you.
Mm-hmm. Okay. One quick note about the dorsalis pedis artery. This is another pulse that you can take for determining blood flow to the foot, I suppose. So the dorsalis pedis artery, and just palpating that region between the extensor hallucis longus tendon and the extensor digitorum longus tendon to toe number 2. That region right in between there is where the dorsalis pedis artery runs. All right, so major veins of the foot. So we have all these little veins coming in from the digits that all empty onto the dorsal venous arch. That's a continuous vessel along the dorsal part of the foot. Then that continues on past the medial and lateral malleolus and become the great saphenous vein and the small saphenous vein that we've talked about before. Okay. All right, so innervation of the foot. We have the tibial nerve coming through that tarsal tunnel. It splits into the lateral plantar nerve and the medial plantar nerve. The medial plantar nerve supplies the medial 3 digits, as well as portions of the sole of the foot. And the lateral plantar nerve supplies the lateral 2 digits. Or so the medial nerve actually supplies the medial 4 digits, so it goes all the way out to digit number 4. And then we've got overlap right here at digit 4 between the two. And then the lateral plantar nerve sends branches in to innervate some of the middle portions of the sole of the foot. Okay. And this is both sensory and motor nerve, so it's a mixed nerve. We flip the foot over. We have the dorsal side. We have both the deep fibular nerve and the superficial fibular nerve coming down into the foot. The superficial nerve is predominantly sensory and supplies the sensory innervation for the majority of the dorsal portion of the foot. There are some slices on the sides that are supplied by the sural nerve and another one that I can't remember at the top of my head. But the majority of the foot sensory innervation comes from the superficial fibular nerve. The deep fibular nerve is the motor nerve, has more motor. It innervates the extensor digitorum brevis and some of the dorsal interossei muscles. And then it also supplies some sensory fibers to this region right between the first and second digits. So kind of a limited sensory supply. So sensory from the deep fibular nerve. Okay. Okay, so that is the end of the foot. It's all I want you guys to know. Just remember that the superficial layer of foot muscles on the plantar side, those are the ones that I want you to know in detail. The rest of them, just be aware that they exist. Any questions about any of this?
Did you say tomorrow we're having a speaker?
No, tomorrow we're going to try to cover some big overview aspects of the upper limb to make sure that you're prepared for whatever Dr. Carlson brings out of the bag on Thursday. So remember, he's coming right after the quiz on Thursday for lab period time. Okay? Any other questions? Okay, that's it. Enjoy your extra half hour of freedom.
Dr. Burton.
Yeah.
So on Thursday, is it going to be like, oh, he's going to start talking at this time, so we get to be done with your quiz by, or like,
I've asked him to come about 3:30.